Hello, everyone. My name is Dr. Michael Walden. You're listening to Ask the Blood Detective. Today's podcast show focus is how to heal. And I really should have named it How to Heal and Not to Die Prematurely from Stupid Things. And I mean that because many of us are dying prematurely of preventable diseases or conditions or incidences that could have been avoided or mitigated in some way that was within your control. For those of you who are new to the podcast, welcome. I am, as I mentioned, Dr. Michael Wald. I'm the original blood detective, and I was nicknamed the blood detective because of my focus and my passion for going beyond lip service when I'm managing my clients and giving them what they need for their needs, for their unique biochemistries and nutritional deficiencies, for example, as opposed to some general health advice. Feel free to take a look at my website. There's tons of free content at www.drmichaelwald.com. That's drmichaelwald.com. And you can email me your questions and comments and perhaps some show topics you'd like me to cover in the future at info@blooddetective.com. And my phone number is 914-552-1442. Okay, so let's get into the topic, how to heal. We'll be talking about that, and I'll be mentioning the different types of healing, physical healing, emotional, spiritual, for example. I'm going to discuss with you briefly the top 10 causes of death in the United States and what you can do to mitigate those causes of death, which include things like medical errors and adverse drug events, infections, surgical complications, poor medical care in terms of follow-up, and more. And of course, no conversation on how to heal would be complete without discussing, well, how do you know that you're actually healed from something? And there are several aspects of that question that I'll be discussing. And finally, as the blood detective and in all of my Ask the Blood Detective podcast topics, I always give you practical details on the laboratory tests that you can know about and learn about and request for your health problems and knowing how to read them, these tests, both medically and nutritionally. So before we begin, I just want to give a quick disclaimer, as you might imagine, that this information is for your education. It's not meant to substitute for sound medical or health advice. So this information is, you use this information or misuse this information at your own risk. So please be careful and discuss any changes in your healthcare with your qualified healthcare professionals. All right, what is healing? Now, of course, we could philosophize all about that, so forgive me. This is a short podcast, so I'm going to get right to the meat of things. So to me, healing is a complex and multifaceted process that involves the restoration of health, also well-being and balance to an individual or an organism. And the process of healing, in my mind, can occur on various levels. As I mentioned, the physical, emotional, mental, spiritual, and can be triggered by a wide range of factors. So let's talk about the physical healing part first. So physical healing obviously refers to the repair and the restoration of damaged tissues, organs, or organ systems within your body. And that can be achieved through various means, such as the body's innate healing processes. Medical interventions can, of course, promote physical healing. That's what we're discussing right now. Or alternative therapies, or complementary, or holistic, what I do. And I've been doing this for about 30 years, so I can tell you that I've had plenty of experience confirming whether or not a person has healed by looking at their chemistry and coordinating that effort with how a person is presenting and how they feel. But we can't just stop there with how a person feels. You can feel like you've healed, but it may not be an accurate representation. I have had dozens upon dozens upon dozens of people who have come to me and they said they felt fine, or they had healed themselves from something, and when I look at their chemistry, it's a mess. In some cases, it's a nightmare with evidence of metastatic cancer, for example, and the person feels absolutely fine. My point is, just because you feel good doesn't mean you are healthy. Sometimes it takes looking deeper into a person's chemistry or other aspects of imaging in medicine or other techniques to determine if someone is actually healed. And again, as I promised, we're going to end today's conversation with how you know you've healed. So we just defined what is healing. I then described a little bit about physical healing. So for example, to give you an example of physical healing, when a person suffers a cut or broken bone, the body's innate healing processes forms clots, activates immune cells that go to the damaged area, and eventually, ideally, repairs the damaged tissue. And then there's emotional healing. So emotional healing addresses the psychological and emotional trauma, pain, or distress from our problems. So that is emotional healing. I'm going to say that again. Emotional healing involves addressing and resolving psychological and emotional trauma, pain, or distress. And this could be achieved through various therapeutic approaches such as psychotherapy or counseling or support groups, and also an individual training themselves in the proper use of general semantics. You might want to search my podcast for one called Cognitive Distortions, where I review the top cognitive thinking errors that get in the way of a person's life and happiness, you might say, and also their healing. And it's important to keep in mind that emotional healing can also occur through self-reflection, mindfulness, and self-compassion practices, like saying, for example, and in your mind, thinking of you taking care of yourself and how you would treat yourself if you loved yourself. You'll find that your thinking and your actions are quite different when you approach your healing that way. So, for example, a person who has experienced a loss or a traumatic event might undergo a healing process by working through their emotions. So they might seek professional help and engage in activities that promote emotional well-being. Now let's talk about the mental part of healing. Just a few moments ago, I mentioned cognitive thinking errors. So keep these in mind as I describe to you briefly the mental healing aspect of healing. So mental healing is a process of addressing and resolving cognitive distortions, unhealthy thought patterns, or mental disorders. And mental healing can be achieved through various therapeutic approaches available in the healthcare circle, such as cognitive behavioral therapy, which is abbreviated CBT, dialectical behavior therapy, or DBT, or other evidence-based interventions. Mental healing can also involve self-help strategies such as mindfulness practices, journaling, which is a great one, and setting personal goals. For example, a person struggling with anxiety or depression may undergo a healing process by working with a mental health professional, engaging in self-care practices, building a supportive network, improving their diet, taking the right nutritional supplements to promote mental healing. So we've talked about so far, everyone, physical healing, emotional healing, mental healing, and then that brings us to spiritual healing. And of course, I can go even further, but the mental, emotional, spiritual are the three basic categories of healing. I just wanted to set a baseline with everyone here today. So spiritual healing is a process of addressing and resolving issues related to one's spiritual well-being, as the term implies, which can involve personal beliefs and values and your sense of purpose in your life. And that can be achieved through various means such as prayer or meditation or engaging in spiritual practices. So spiritual healing can also involve connecting with nature, engaging in community service, or seeking guidance from spiritual healers of different sorts. For example, a person who's experiencing a crisis of faith or a sense of disconnection from their spiritual belief may undergo a healing process by exploring their spirituality, engaging in rituals, and seeking support from others who share similar beliefs. So, sort of in conclusion, just to wrap that section up, healing then, if you think about it, is a multifaceted process that can occur on various levels, including the physical, emotional, mental, and spiritual. And the process of healing often involves a combination of self-care practices, therapeutic interventions, and support from others, people that you trust and love. So now let's attack the top 10 causes of death in the United States, which can impact and influence all those different forms of healing that we just spoke about. So many of you might be surprised to learn that in the United States, at least, various factors contribute to the overall mortality rate in the population. So according to the CDC, the Center of Disease Control and Prevention, and the National Center for Health Statistics, there are 10 top causes of death that affect both men and women and slightly differently. So right now, I'm going to run down super quickly those top 10 causes of death in the United States, and then we're going to look at each one and then what you can do about them. So number one is heart disease. More people are dying of heart disease more than anything else. Number two is cancer. Number three is unintentional injuries. Number four, chronic lower respiratory distress. 5, strokes. 6, Alzheimer's disease. 7, diabetes. 8, influenza and pneumonia. 9, nephritis, nephropathy, and hypertensive diseases. So the nephritis and nephropathy refers to the kidneys. And then number 10 is suicide. So while these top 10 are the leading causes of death for both men and women, it's important that you all realize and note that some causes affect one gender more than the other. For example, heart disease and cancer are the leading causes of death for both men and women, but men are more likely to die from heart disease, while women are more likely to die from cancer. And in addition, unintentional injuries, which was number 3, such as car accidents or falls, are a leading cause of death for men, while women are more likely to die from Alzheimer's disease and diabetes. I should mention at this point that all of these notes you can find on my website at www.drmichaelwald.com, and just search the search bar for the title of this presentation, which is How to Heal, and these notes will come up. So, but I would encourage all of you to take notes anyway, because you will learn things better. You will retain things better, because writing involves thinking, and thinking and writing are being present processes. So that's my strong suggestion. Write it now and then read the notes. And to finish off, I was talking about unintentional injuries, and I mentioned that unintentional injuries like car accidents and falls kill more men, and Alzheimer's disease and diabetes kill more women, and then conditions that affect the kidneys and hypertensive or high blood pressure issues and lung problems affect both genders quite differently. So that's interesting to keep in mind. So number one, medical errors. So medical errors such as incorrect diagnoses. I read in some reports that upwards of 80% of medical diagnoses are wrong. Up to 80% of diagnoses are wrong, folks. And this is from doctors that have gone through 5 to 12 years plus of education, and they're still getting this wrong. Now, what does that mean? That means that a large percentage of the treatments and medications for all of these wrong diagnoses are also wrong. So we're talking about, as I mentioned, incorrect, so medical errors, just mistakes, such as incorrect diagnoses, wrong prescriptions or treatments that can lead to serious harm or death, and does lead to death for many people. According to a study published in the, I believe it was the British Medical Journal, medical errors contribute to about 250,000 deaths per year in the United States alone. 250,000, that's 250,000 people. So these errors highlight the importance of proper communication and collaboration among health professionals and among health professionals and their clients to help ensure proper diagnoses and treatments. In other words, folks, if you become your own blood detective, which is the point of all these Ask the Blood Detective podcasts, is that you're not serving as your own doctor per se, but sort of as a surrogate. So your involvement keeps people on their toes. So when I have a client that asks a lot of questions and asks me to do research and is clearly proactive, they are waking me up in a sense and calling my attention to them. And, the fact is I'm going to focus on them differently. So I pretend that all of my clients are that way. By doing that, I provide a certain level of attention and competency to everyone. But it wouldn't happen unless my clients, though, were also proactive. So that aspect of improvement of medical care and reduction of medical errors, your participation cannot be substituted in any other way. Now, medical errors was number one. Number two, cause of death in the United States are adverse drug reactions. They're also called ADEs. So ADEs are injuries resulting from medication errors or incorrect use of medications. So these include allergic reactions, overdoses, or interactions with other medications. And many pharmaceutical companies, there are interactions and deadly ones between some medications produced by different pharmaceutical companies, but because they're different and they don't want to work together, these risks just keep accumulating. So the adverse drug reactions are a significant cause of patient harm, and that leads to increased morbidity, which is quality of life loss, and mortality, which is death. And the Institute of Medicine estimates that between 7,000 to 9,000 deaths are caused by adverse drug reactions each year in the United States. So we've got 7,000 to 9,000 deaths from just drug reactions. We have 250,000 deaths from medical errors. So where do the other deaths come from? Number three cause of death is infections. Hospitals and other healthcare facilities can and are breeding grounds, no matter how clean they might look to you, for infections such as hospital-acquired infections or antibiotic-resistant infections like C. difficile. Poor hygiene practices, inadequate sterilization of equipment, overcrowded wards can contribute to the spread of infections, which increase morbidity and mortality rates among patients. When I was doing my medical rotations and I was in a hospital and I had the pleasure of having the chief of internal medicine gastroenterology being my doctor, and he took me on, my teacher, he took me on one-on-one. And I remember us going into a room which was quarantined because the patient had a C. difficile infection, which is an infection that is caused by the use and or overuse or even the proper use of antibiotics that kills hundreds of thousands of people every year, not just in hospitals, but also in the populace at large. And I remember we had to put on little booty things over our feet, and we had to wear gloves, and we had to wear hair coverings and face masks and all of these protocols. And there were big red signs on the door, don't enter, all of this. And we go in there, and the person has horrific diarrhea all over the bed, which is what C. difficile is characterized by, this unremitting diarrhea. And the doctor does his thing, and he had the patient's chart, and he put it down on the table for a moment. And then we walked out, and then he put the folder, the patient's folder, their file on the nurse's desk. The nurse took that. And do you think that C. difficile infection and other infections could have easily been on the furniture in that room, which was not covered, by the way? And we know that the diarrhea produces microscopic air particles which land on everything. I know it's gross. What I'm trying to say is there's really no way to protect yourself. You can lower your risk somewhat in hospitals, but this was the chief, and he basically potentially contaminated the whole hospital by how he acted. And he was just following the basic protocols in the hospital that even in this day and age are practically useless. So it was a real eye-opener for me. And then there are surgical complications, the number 4 cause of death. So surgical complications include infections, bleeding, or organ damage, and that can occur during or after surgery, which can lead to serious health consequences or even death, obviously. A study published in the Journal of the American Medical Association found that nearly 1 in every 100 surgeries in the U.S. results in complications. I think it's probably higher than that. I think many of those complications are hidden away for doctors to avoid lawsuits. And then there's inadequate follow-up care, number 5, as a cause of death. Think about that, inadequate follow-up care. My own grandmother died of colon cancer because she failed to follow up with her doctor. And, she came from a very long-lived family and did live until she was quite old. But, there could have been a few more years there if the follow-up was there. And I've had many examples of clients that they're so scared of their medical doctors that they don't get even some simple tests that could help find conditions that are treatable early. And then, of course, there's the lack of the doctors or medical staff not telling you need to have this colonoscopy at age 50 and you need to have this mammography at this age and et cetera, et cetera. Now, some of you might say, well, I don't agree with those tests and I don't want those tests. Well, that's fine, and that's a whole other question. But I'm just giving it as an example that if the medical practice, they are obligated to let you know when certain tests should be done for in the hopes and for the goal of preventing disease from killing you prematurely. I mean, we all have to die of something, but let's die of it later in life. And then there's overcrowding and lack of resources. So overcrowded hospitals and a lack of resources can lead to suboptimal care and increased risk of errors. And that results in delayed diagnoses, incorrect treatments, and a higher risk of infections and other complications. And then there's inadequate communication, number 8, which I just hit on a little bit ago. Poor communication among healthcare providers can lead to misdiagnoses. The doctors just don't talk with one another. Their egos are just in the way. Of course, I'm generalizing, but I've found this is mostly true, having treated thousands of patients over the course of 30 years. And I've had plenty of opportunity to view poor communication. I graduated medical school, but decided not to get an active medical license because I thought it was a waste of my life. I preferred to go to chiropractic college and then learn acupuncture and then become a dietitian and board-certified nutritionist and life coach. So I can tell you from all that education and exposure, I have seen and witnessed inadequate communication. Then there's number 9, insufficient patient education, which of course is linked to inadequate communication between healthcare providers, but they fail to speak to clients. So patients who are not adequately informed about their health problem or treatment options and follow-up care may be at an increased risk of experiencing complications. So providing clear, concise information to patients and their families helps them make informed decisions about their care and how to better manage their care, which is the point. We want to manage these issues so they don't become a cause of death or premature death in you. And then the last major cause of death of the top 10 is ineffective infection control measures. As I've talked a little bit about with the C. difficile example, inadequate infection control measures such as poor hand hygiene, inadequate sterilization of equipment in hospitals and medical offices, and inadequate isolation precautions, which I mentioned too, can contribute to the spread of infections and increase morbidity and mortality rates. Okay, so now we have an idea of there's different levels of healing and types of healing, emotional, physical, spiritual, etc. And we just reviewed the top 10 causes. Of course, there are many other causes. Maybe I'll cover the next 10 in another show, depending on what you guys want to hear. Now I want to talk about the laboratory part. This is the blood detective part. So you want to really listen up here. And again, just a reminder, take some notes. For those of you just joining us, welcome. You're listening to Ask the Blood Detective. My name is Dr. Michael Wald. I am the Blood Detective. I practice in Westchester County, New York, which is an hour north of New York City by car or Metro North train. I am a licensed doctor of chiropractic. I do provide acupuncture, life coaching, and I'm a board-certified nutritionist. I did go to medical school. I do have that education, but I am not licensed to practice medicine. I did all of this so that I can provide well-rounded information and perspectives for people, because for me to limit my exposure to different aspects of holistic health only limits you. Okay, let's get into the top 10 laboratory tests for health assessment, so you might have a fighting chance of delaying the onset or preventing certain causes of premature death and death. So the first blood test is called a comprehensive metabolic panel, or CMP. Every doctor basically does a comprehensive metabolic panel and a CBC, which is a complete blood count. So those are the two basic ones. Some doctors I've seen don't do both of those, which is astounding to me. It just takes a little flip of the pen on a piece of paper for the doctors to do both of these things. But now you will know what you need. So you need a comprehensive metabolic panel. And that's a set of blood tests that measure electrolytes and kidney function, liver function, blood sugar, and acid-base balance. And this panel helps identify nutritional deficiencies, renal problems, metabolic disorders that can impact your health. So that's what a comprehensive metabolic panel is. And then there is the complete blood count, or the CBC. So a CBC provides information on the red and white blood cells and platelets and hemoglobin levels. And these tests help identify anemias, which are like iron deficiency anemia, for example, inflammation, and other blood-related issues that might be indicative of poor nutrition or underlying health problems. And the next several tests can be found within the comprehensive metabolic panel and the comprehensive blood count that I just reviewed with you. So, for example, albumin and globulin. So those are part of the metabolic panel always. So these tests measure the levels of two types of blood proteins, albumin and globulin. Albumin is essential for maintaining fluid balance in the body. So when there's problems with fluid balance, your body will accumulate fluid in all the wrong places. While the globulins are important for immune function. So immunoglobulins, are immune cells. And low levels of either of these proteins, either of the albumin or of the globulin, might indicate malnutrition, inflammation, and dehydration. And then there's renal function. And the renal function also should be part of the comprehensive metabolic panel. So this test for renal function is called blood urea nitrogen, or BUN, B-U-N, blood urea nitrogen. And there's another related test called creatinine clearance. Both of those tests are the minimum tests to look at renal function. And renal function, or kidney function, is crucial for maintaining electrolyte balance and getting rid of waste and toxins, which might be affecting your overall health and well-being. And these tests can be made abnormal due to everything from high blood pressure to autoimmune disease to malnutrition, inflammation. Literally dozens of conditions can adversely impact renal function. And then there is a body composition analysis. This test is not part of the comprehensive metabolic panel or the comprehensive, or I should say the complete blood count. So it's not part of the CMP or the CBC. So a blood composition analysis measures the percentage of body fat, lean mass, and other factors in the body, such as phase angle and fluid balance inside and outside of cells, and is fundamental as a biomarker, folks, for predicting overall morbidity and mortality, which means that if you have a poor body composition test, and I'll even go so far to say as a poor body composition result that is worse than your baseline, after you've made attempts to improve your health, it means your attempts are not working, again, no matter how you feel. It doesn't matter if you are doing yoga, meditation, eating a specific diet, taking certain supplements, a combination of all of those and other types of healing methods. If you do not improve your body composition analysis, specifically one of the factors which the body composition analysis measures, known as lean mass, which is your muscles and your organs. So that's everything. Well, meaning that's all the important things in terms of if you're losing mass of your organs, that's it. We know that loss of lean mass, organ and muscles, is the most predictive test of when you're going to die and the quality of your life. So it's the best test, body composition, for predicting morbidity and mortality. So I do that with every client, just like I do malabsorption tests with every client. I'm shocked when I see people come to see me, particularly when they have chronic problems that haven't gone away in a while, and they've never had a malabsorption test. Well, how do you know how much someone needs? And, we're not what we eat, right? We're what we absorb from what we eat and the consequences of what we don't. So we need to know absorption. We need to know body composition. Most people need a CBC and a CMP. The next test is a zinc taste test, or a zinc taste test. So zinc is an essential mineral for immune function. Most people know that. And also growth of tissues, wound healing. And low zinc levels can be indicative of poor nutrition, inflammation, and just lack of healing. So it's important that a blood test be done. And also there's something called a zinc taste test, which you can probably look up. Actually, you can look it up on my website at drmichaelwald.com, which basically has to do with a very quick test where you're tasting liquid zinc. And if you don't taste it, you're deficient. And if you do, you're not. So you might want to check out that on the website as well. It costs like 5 cents to do that test. And then there are blood sugar levels, which are part of the metabolic panel. Fasting blood glucose and another test called hemoglobin A1C help identify blood sugar level problems and the risk for developing diabetes or other metabolic disorders. I suppose you need to fundamentally know that proper blood sugar control is crucial for healing and preventing complications related to poor nutrition and inflammation. So doctors in traditional medicine tend to wait until blood sugar is extremely high, and they won't do anything if it's high normal. See, we know that a blood sugar level, let's say, shouldn't be greater than about 112, let's say, and no lower than about 85. But people who have blood sugar levels on the higher end of that range have more heart attacks than people who have blood sugar levels on the lower part of that range. So there's an optimal place to be within each range for every blood test. And if you want to know more about how to medically and nutritionally interpret labs beyond the top 10 we're doing here for just overall healing, definitely search blood tests interpretation on my website. Again, drmichaelwald.com. And then there are before I go to inflammatory markers, just one more thing about blood tests. There's the test that I mentioned, hemoglobin A1C. That is a test of several weeks average of your blood sugar. When you get your blood glucose checked at a doctor's office, that's your blood sugar literally at that moment, which could be different 5 seconds from that moment or 5 minutes from that moment. But the hemoglobin A1C is an average of several weeks. So you want to know what that shows as well. And you do not want to be higher than a 5.7% on hemoglobin A1C according to traditional medicine. I think that 5.4 is where you should be. 5.7 is too high, and many doctors not only ignore even 5.6s, which are very close to 5.7, they're ignoring 5.7, telling people, oh, you're borderline diabetic. Yeah, that's when all the problems start, not when you're finally diagnosed. That's when all the problems have accumulated. So you need to get these abnormalities determined earlier than traditional medicine tends to. That's why I've developed and have incorporated into my interpretation of people's blood what I call functional or healthy blood ranges. I gave you one example with blood sugar, that the optimal blood sugar should be 85. Even 86 is associated with a much higher risk of developing diabetes, and that 86 is still within the normal range of glucose. So what you should take away from that example, and I can give you many other examples, is I compare people to the clinical ranges like every other doctor does, but I also compare them to where the healthy ranges should be. I'll give you one more example. LDL cholesterol. On a blood test, it'll actually state this, that 130 milligrams per deciliter is normal. And a LDL of less than 100 is considered, or 100 or lower is considered optimal. So medicine is starting to catch on that there are optimal places to be in these ranges. And that's why so many people say to me, Dr. Wald, I don't understand it. I don't feel well. No doctors can find anything. My blood tests are normal. Well, they're normal, but why would I want to compare you to a normal person your age who is probably unhealthy? I want to compare you to a younger version of yourself 10, 20 years ago, or my clinical healthy ranges of blood tests. If I compare you to healthy ranges of blood, you're going to have many more abnormalities that are going to pop out that are hidden when you're being compared to the average or clinical ranges that you find on your blood test. All right, enough about that for now. And then there are inflammatory markers, tests such as C-reactive protein and another test called ESR. These are both extremely useful inflammatory markers. They measure chronic inflammation, which can be caused by or contributed to poor nutrition, tissue damage, weakened immune systems, infection. And the ESR is a generalized inflammatory marker, and the CRP, if you get the CRP cardio, is more specific for cardiac issues. And they both are managed differently, depending on the overall situation with a client. And then there are nutritional deficiency tests. So tests for vitamins and minerals such as B12 levels, folic acid levels, iron, calcium, magnesium. And doing these levels of these nutrients can help identify deficiencies that might be contributing to poor nutrition and impaired healing. And then there's protein and amino acid profiles. So these tests measure the levels of individual amino acids in the blood or the urine, which are the building blocks of proteins and neurotransmitters in the body for brain health or any healing of tissues. Amino acid imbalances can indicate poor nutrition, malabsorption, inflammation, and other health issues that might hinder the healing process. So those were the top 10 minimal tests that you should think about. And depending on your particular health concerns, if you were sitting before me and we were having a conversation, based on our conversation, I might determine very different tests or some of these tests and not others. And I might include yet others that we didn't talk about today. So that's what I mean by being a blood detective. Being cognizant that people have different needs, even with the same diagnoses, that how you feel is not necessarily an indicator of your health, and how it is important to know some specific tests, how to interpret them and what they might mean, so that you can have meaningful conversations with your healthcare providers and work as a team. And if your healthcare providers are too egotistical or for whatever reasons refuse to work with you, then this is just unacceptable, and you might want to consider getting a different health professional. And one of my ulterior motives for having people push me on things is because it makes me better. It teaches me stuff. I'm not happy thinking that I'm not going to learn anything during the course of a day. I have an active mindset that anyone that I'm sitting with during a consultation can teach me something. If I don't know something that they mention, I don't pretend to know it. I will look it up though, and I will learn it. So it benefits me to learn from you. And you might actually learn a few things from me. And together, how could we not have a better outcome than either one of us alone? Okay, the last part of this conversation today, really important, is recognizing that you're actually healing. If feeling better and normal laboratory tests based on clinical ranges are not necessarily accurate indications of how you're healing, how the heck do you know if you're actually healing? Well, I'm going to give you 5 brief responses to that. So first I'll just say, to determine if you have healed from a disease or a condition, it's essential to understand a few factors that contribute to the healing process. So we've talked about how healing can be both physical and psychological and can involve various stages. So in this brief conversation here, I'm going to go over a couple of aspects of the healing process that you can now recognize that you need to individually evaluate to know that, yep, you have reached your goal of healing. Number 1, symptom improvement. Now, I just said that feeling good is not necessarily an indicator of healing, but sometimes it is. So it should at least be considered in context. So one of the primary indicators of healing is the improvement of symptoms associated with the disease or condition. As the body recovers, the severity and frequency of these symptoms should decrease over time. If they decrease over time, folks, as your chemistries and other tests improve, then you know you're actually healing. If you feel great and your chemistries and other test results are not improving, you're not actually healing. So it's important to monitor the changes in your symptoms. Symptoms are what you feel, and signs are what the doctors see. So it's important, again, to monitor these changes, to consult a healthcare professional if there's any concern about the process of your recovery. So that's symptom improvement, number 1. Maybe you're healing. Number 2, return to normal functioning. So as your healing process continues, you should experience a return to normal functioning in daily life. That might include Might include resuming work, engaging in physical activities, participating, for example, in social events without any significant limitations or restrictions. And if you can return to your previous lifestyle without any issues, that certainly sounds like a strong indicator that you might have healed from your disease or condition. So far we've got symptomatic improvement and returning to function. The next concept that you should consider when you are trying to determine, are you actually healing or just having a good day or a good week or a good month or a good 6 months, is medical professionals' assessment. So in many cases, a healthcare professional like myself will be the best judge of whether or not you're healing from a disease or condition. Regular checkups, follow-up appointments, comparative testing are crucial to track the recovery and to receive guidance for further treatment and management if needed. So a medical or health professional's assessment can provide a reliable and informed perspective on the healing process. Now, we've talked about during this podcast today on healing that there may be misdiagnoses or poor communication with doctors. That's all true. But now you're aware of those things, so you're going to be listening better, and you're going to consider your health professional's assessments along with returning to normal function and along with symptomatic improvement and along with results getting better. And there are just two other brief areas, namely emotional well-being and prevention and maintenance, that you should consider in context when assessing whether or not you're healing well. One is healing, again, emotional well-being. So healing from a disease or condition may involve not only physical recovery, but obviously emotional and psychological healing. So it's important to address any emotional distress or trauma associated with the illness and seek support from friends, family, mental health professionals, a life coach, which is what I do. And achieving a sense of emotional well-being can be a strong indicator that the healing process is happening or is complete. So if a client of mine is going through psychological trauma and having an issue dealing with how they function, someone might say to them, well, that's normal given what you're going through. Well, it might be, but we need to unwrap that. We need to unpack that and manage it, because how a person deals with their discomforts and problems can impact them. So for example, I have a very high pain tolerance. I have had many injuries during my triathlon efforts and my karate and weight training, but I don't sit around and cry about those aches and pains like I used to. For example, when I was in discomfort, I might stop doing all exercise, let's say, for weeks at end. This was earlier in my life. And then I said to myself, well, maybe I don't need to do that. Maybe I can tough my way through it and I can do something, maybe not exactly what I was doing before. And I found other things to do. So my whole orientation and my emotional and psychological approach to how I feel and what I can do changed. So that's important to keep in mind. And lastly, prevention and maintenance. So to ensure long-term recovery and prevent relapse into your condition or symptoms again, or signs, it's essential to maintain a healthy lifestyle and to follow any recommended preventative measures that you might have gotten from your healthcare providers. So they may include adhering to a balanced diet, engaging in regular exercise, maintaining regular checkups with maintenance checkups with healthcare professionals. Those are very, very crucial. A commitment to self-care and prevention also can be a very strong sign that you are healing or have healed from your condition. So that's a lot to take in, actually. And, since it's such an important topic, how do you know you're healing? My suggestion is you at least read the notes that you'll find on the website at drmichaelwald.com. That's drmichaelwald.com. Let me know your thoughts. You can email me at info@blooddetective.com. My phone number, if you want to work with me personally, is 914-552-1442. Thank you so much, everyone, for participating and listening to How to Heal, today's topic on Ask the Blood Detective, and I'm looking forward to seeing you soon. Bye-bye.